everyone, my name's Alan Gardner. I'm a student paramedic at Blackpool Ambulance Station, and I've been on the road now for approximately 5 years. My daily routine normally starts pretty early. I'm on a 7-7 shift, so I'll be up at 6ish in the morning, try and get in early, 6:30, to relieve the crew who we're taking over from, so they can head off and get their rest. We come in, we take over the vehicle, get our radios, check our equipment to make sure we've got enough to sustain us throughout the day, check our drugs, make sure everything's ready to go that way. Then we'll sign on through control, who dispatch us and allot us our jobs, and then basically we're removing crew then.
My name's Ron Stewart and I'm a senior paramedic. So I joined mid-20s. This is my 29th year and still going. I've always enjoyed coming to work. It's very challenging and never 2 days alike. So it's good in that respect. It doesn't get boring at all.
Hi everyone, just a quick look around our working environment at the back of the ambulance. Our response bag, which is what we take into people's properties and things. That's got everything that we require in there for airway management, for breathing support. It's got all our cannulation kit in there, it's got our wound dressings, it's got our burns dressings, it's got our oxygen, it's got all our respiratory requirements for our face masks and things like that. So that's pretty much what we work to and what we work from. We've got our burns, we've got our balls, inco pads, yeah. We've got our normal waste, domestic, clinical waste, and then moving across this side we've got our respiratory support with our nebulizers and our oxygen masks and things like that. As you can see, we've got our carry chair, which is just down in the corner there, which is obviously how we move patients in and out of difficult areas and we get them up and down stairs. And then coming across this way, we've got our oxygen bottles, we've got our infection control, we've got our maternity packs so we can deliver babies on scene. We've got our CBRN, which is our chemical, biological, radiological and nuclear equipment for our own protection as you know, things get a little bit worse on the streets. And pretty much that's it really. We have a communication system, so in the back you can communicate with the driver in the front, and we have a CCTV system that will keep us safe in the event of any danger, and should we be able to record it if we need any police intervention.
No, but
yes.
my husband did.
Yes, my husband
very
did.
good
Yes.
indeed. Oh, very. We've got 30
Yeah.
stairs and no lift. And they carried him down in a chair. And one ambulance man went backwards down the stairs and my husband's legs on his shoulder. And the other one lowered the chair down. Imagine. Brilliant.
Yeah, very good.
On time, paramedic.
What made me decide to become a paramedic? I had a sort of general interest in it from the public's view of the ambulance service, and that sort of intrigued me, and I just wanted to come and see what it was all about. I think it's all to do with skills, isn't it? And I think being in the ambulance service is a vocation, and you ask most people, everybody needs an income and everybody needs money, but if you can do something that you enjoy, and it's quite a prestigious position to be in, to help people and to be allowed to help people, I think you can't necessarily put a price on that. That might sound a bit cheesy, but we're very fortunate to do the jobs we do, and there's such a huge demand for people to undertake the training to move to become a paramedic and beyond.
It's something I'd always had at the back of my mind, but I didn't realise what qualifications you needed to get into it. I mean, we're talking early 80s, you know, it's different to today where they need lots of academic qualification. In those days you didn't do, you see. It was basically common sense, driving licence and a first aid certificate, because in them days there were no paramedics, you see. So it's evolved very much over the last 20 years.
As I became more and more aware of the ambulance service and what they did, it was something that I definitely wanted, and has become one of my goals. I've still got a long way to pursue. It's one of those things where you never stop learning, and you're constantly developing your skills. And communication is key, and I think if you've got good communication skills and you can read situations, you can make life generally easy for yourself and easy for the patients that you treat. So it's hard in the fact that we do a lot of jobs, a lot of emergency calls, and some of them are quite physical and some of them are quite sort of psychologically taxing, if you like.
Seem to think that it's sights that we see that upset us, it's not sights that we see that upset us. The things that upset us are when we get to a situation and it's too late to do anything constructively, or too late to save a life, especially a young life. But sights don't bother you. You tend not to look at sights, and you tend to focus on what you can do for that patient at the time.
I mean, there are a lot of jobs that do affect your emotions, because you are dealing with people at the end of the day, and you're dealing with people who sometimes are at the lowest ebb, or whose lives for whatever reason have changed that day, from them getting up for breakfast and not comprehending what possibly could happen. I think that's quite challenging. That's quite different. Some of those jobs, when you get a good outcome, for example, if you deliver a child, a baby who wasn't expected to be delivered at home because of, mum's just not quite got to the hospital, they're very emotional, bringing, life into the world. On the same count, we'll go to people who will have passed away in their sleep, and we'll certify them as, as being dead. So again, life and death, births and deaths, they tend to strike a note with you.
Anything could be improved? Yeah.
Well, we're improving, but it's going to be a very small release.
Well, I think there could be more of them.
Yeah.
Put it that way.
That'd be better.
You know,
More
they're
of them.
spread out too much now, aren't they? The distance they have to travel. I think more is essential, don't you? Things seem to be spreading out more and more, and really, it should be the other way around.
The hardest thing I find really is coping with the demands that are placed on us these days. I mean, the workload is increasing astronomically really over each year, and more people are calling you for less and less real needs, and this is the biggest challenge.
Surprisingly enough, we have quite an ageing population, and a lot of the jobs that we undertake are what would be run-of-the-mill or quite routine, but the general public wouldn't be aware that we go to a lot of jobs where people have just simply fallen over, and whether that's because of age-related or because of mobility issues or problems. But as the general public's age is increasing, then we're going to more and more jobs where people have just fallen.
It's very hard at the end of the phone to triage and to make a decision honestly on that patient's condition. You can have a gut feeling about the person on the end of the phone, whether they're telling you everything that's truthful, but you get a lot of people, and they mention keywords like can't breathe properly, or I've got chest pain, or I'm losing consciousness, or the patient's losing and those type of words trigger the emergency ambulance into a rapid response, you see. So we can't get away from that. It's the triage system that we use. But what I would like to see come back, we have trialled it in the file, is what we call Respond Convey, and that is whereby all emergencies were triaged by a rapid response car first, instead of sending an ambulance, and then they decide how important that patient needed to go into hospital, whether it needed to be going in fast, or whether it could wait for 2 or 3 hours. But at least instead of face-to-face triage, instead of a telephone triage, I think it's a safer way to do it.
You couldn't sustain continual trauma emergencies, cardiac arrest type incidents, violent assaults and things in a 12-hour day. Sometimes you need those little run-of-the-mill jobs just to sort of relax you a little bit. And at the end of the day, some of these people fought for this country in the world wars, and I think there's nothing better than helping an old lady to her feet who's been on the floor for a couple of hours, and they're very, very thankful of it. And if they're injured, then we look after them as well. Have been threatened. Normally we can read situations, and depending on where you are and who you are, I think if you treat people like you would like to be treated, then more often than not you can resolve situations. We meet a lot of people where on occasion there's been too much alcohol or other substances that have been misused, and it's just trying to gauge and control those elements. But it's a small space in the back of an ambulance, and we're trained to resolve conflict, and I think once you have a little bit of that training you can stay safe. But if you're outnumbered and you're in a small space and you're in a corner, then yes, it can be daunting, but it doesn't put you off. We're a big service, there's a lot of other crew members, there's a lot of people willing to step in, and the police are on side as well. So
on average I would say my response times are 3 to 4 minutes from getting the job to getting to the house. Now the problem is we get that many jobs sometimes that the jobs can be stacking up and there's not enough vehicles. So by the time I get a job there might be 10-20 minutes on it. They've had it 10-20 minutes before they've given me. So I can only still respond in that 3 or 4 minutes. So obviously I might get some earache at the other end, but obviously they don't know that, do they? Obviously take some pressure off, and we have urgent care vehicles, and we've got like quite a lot of managers that are in the offices now, but they're still paramedics and can respond in their own cars, with sirens and everything. So we've got plans in place should the activity increase.
A hero is a strange word, and do I consider myself as a hero?
No, not at all. No, just do my job, and it's a good job. I mean, like I say, it's evolved over the years, because when I joined you didn't need any qualifications, but since I became paramedic in the early 90s, I went on and did a bachelor's and 2 masters after that, and enhanced what I already know.
I consider myself someone who wants to help people, and if I wasn't doing it, probably someone else would. Have I walked away from incidents or episodes that I've been involved in and thought, yeah, I did alright there? Of course I have, yeah. And it's a feel-good factor, and helping people does give you good feelings, without a doubt, especially, with successful outcomes. You've changed somebody's day, or you've changed an outcome of a situation because of your training, your professionalism, and the fact that you want to help. How many lives have I saved overall? It's difficult to put a number on it, because we have a patient for a small amount of time, i.e. from the minute the emergency call comes in to when we receive them to when we take them to their destination or where we need to take them. So, I mean, holistically we operate as a multi-service agency, so although the frontline, initial support and initial treatment does make a massive difference, I think the life-saving really comes from the whole team. I'd run it into the, if you're doing 10 to 12 jobs a day and you've been doing this job for 5 years, the life-saving events are very few and far between. The make a difference events are quite considerable. But yeah, a good few. Good.